Everybody, this is Dr. Kamel again, and a new PT license exams preparation hint. So if you didn't see any of my videos before, I work as associate professor of physical therapy in the United States, and I'm licensed in United States, Egypt, and in other areas. I have got my PhD from University of Nottingham in the UK. So let's go to today's content. A patient is lying supine with hips and knees extended and hands behind the head. The patient is able to raise the head, shoulders, and thorax from the treatment table, but is unable to come to a complete long sitting position. What muscle should the physical therapist target for a strengthening program? Okay. Is it so the patient like able to do partial, you know, sit up from supine lying position, but cannot continue to do a long sitting. So, which muscle might be weak or need strengthening? The iliopsoas, the external abdominal oblique, quadratus lumborum, upper rectus abdominis. Which one is the correct option? And the correct option is iliopsoas, but let's explain why. So this question actually is asking you about what is the difference between trunk flexion and hip flexion during sit-up. Okay, so the patient can raise the head, shoulders, and thorax, meaning that abdominal muscles are functioning. However, the patient cannot achieve complete long sitting with hips extended, knees extended, hands behind the head. So the final phase of this movement will require hip flexor strength, especially the iliopsoas, in order to come to a complete long sitting position. Okay. So in a movement analysis, the early phase of setup, raising the head and thorax, the main muscles working will be the rectus abdominis, external oblique. So rectus abdominis, external oblique. Okay. And patient already in this question can do this. And the final phase in long sitting, it will require hip flexion over this fixed leg, which is in knee extension and hip extension. Okay, so the main muscles are will be the iliopsoas. Since the patient cannot complete this phase, then the weakness mostly is in most likely in the iliopsoas. So again, in the early phase of setup, rectus abdominis and external oblique are mainly required, and they are already working. But the patient cannot continue to finally to long sitting because of the weakness of the iliopsoas. Okay. So now let's look at the incorrect options. Option number two, external abdominal oblique. Already this muscle is working and it assists trunk flexion and rotation. So the patient already demonstrate adequate trunk flexion. So this is not the primary deficit in this patient. Option number three, quadratus lumborum. The function it function in lateral trunk flexion and pelvic hiking and is not responsible for long sitting. Okay. How about upper rectus abdominis? It will be active during initial trunk curl up, upper rectus abdominis. Okay. So the patient already can successfully do this movement. So this means that the upper rectus is okay. Okay, and here we said upper rectus and the external oblique are the two main muscles, so they are not a deficit in for this patient. So, in to summarize, sit up with knees extended, strongly emphasize hip flexors, which are the iliopsoas, the curl up or crunch, emphasize abdominal muscles. Okay, how we can remember that? I can give you a memory trick. can lift shoulders but cannot still all the way up, think hip flexor weakness, which is the iliopsoas. Okay. So, final word, the abdominal muscles are active during a sit-up with the knees extended up until the spine is completely flexed, head, shoulders, and thorax lifted from the surface. Okay. In order to come to a long sitting position, however, the hips must be flexed and the abdominals cannot perform this action because they don't cross the hip joint. Okay. Therefore, the hip flexors, the iliopsoas, among others, would have to complete this motion, and the inability to achieve a long sitting position would suggest weakness in the iliopsoas muscle. This was the answer for today's hint. And if you would like to join my BT license exam preparation course, please send me a message on this WhatsApp number 001442 2487206 or 00201027743702. In the meantime, please subscribe to the channel and share the content with your colleagues will be much appreciated. Thank you for watching me and see you soon in a new content.